Borno, and welcome to another edition of the Borno Health Update. I'm your host, Ibrahim Amarawa. Here to shed light on the remarkable strides being made in our healthcare sector under Governor Zulum's visionary leadership. In this program, we focus on the transformative efforts spearheaded by Professor Baba Malamgana, the Commissioner of Health and Human Services, who is driving innovations and resilience in our healthcare system. The nearly 16 years long Boko Haram insurgency led to the significant influx of NGOs into Borno State, while the program of some organizations have effectively supported local communities and complemented government efforts to resettle residents and rebuild infrastructure. Others have operated for years, spending millions of dollars with little visible impact on the ground. This situation prompted Governor Zulum to mandate that all NGOs operating in Borno State must submit their program plans to the government for approval and provide clear details of their intended activities. To ensure these NGOs effectively complemented the government's initiative and to bring more oversight of their operations, the Ministry of Health, with the support from Lapia UK, has developed Partner Exit Plan. This framework is designed to ensure the sustainability of health program initiated by NGOs. As Health Commissioner, Professor Baba Malamgana explained that during the validation of this plan, its importance is paramount. He stated that any NGO working in the state's health sector must now agree to this plan. This is to guarantee that funding intended to aid the people of Borno actually reaches them and delivers tangible results.
So let me also appreciate you all for being here and spending so much time and doing a thorough job. From what I have just had a bird's eye view, really it is fantastic. It is first class, and whoever doesn't plan, he will plan to fail. So therefore, this is the way forward. Let me appreciate the Lafia UK with our state coordinator, Dr. Abogular Gema, for being with us all the time. He has done everything possible to strengthen the healthcare system in the state. And he is a shining example of a partner in the state. Unfortunately, the insurgency that engulfed Borno State, which is now about 16 years, so this is the 16th year, has brought in NGOs and some new partners. And some of their activities, or most of them, are brilliant, are excellent, but we have to plan and plan their pre-exit, their exit, and post-exit. I'll give you one or two examples of brilliant ones. I've given you Lafia UK. We have MSF Belgium, which has built as an emergency obstetric and newborn center on Kweshari, Dembo Road. And they've never built such a hospital in any part of the world. This is the first time. Because the ambience was right, and therefore they decided they would help us. And ab initio, they agreed they will build, train, and transfer to the state government. So when the building was ready, the first year, they gave us 30% responsibility for us to take care of, which included 30% of the staff that will be working in the facility, which were responsible for their salary. And that means transfer of skills. If you've never been there, I would urge you to pay a visit. It's really a fantastic place, first class. I won't mention the names, but two female top of the tree went there. They said, "Oh, we feel like having a baby here." You know? This goes to show how excellent the center is. So, and they have given us 4 years from the beginning, so that in the 4th year they will transfer everything to the ministry, and they will begin to pack their bags and go. So this has been agreed, and every year we're taking more and more. They're reducing more and more, and the 4th year then they will leave, and then it will be under the custody of Borno State government. So this sort of planning has been taking place, and the new NGOs coming in, for example, MSF Spain, they had to also agree on terms like this, so that I will not sign the MOU until we have proper planning.
The commissioner further added that the Ministry of Health has already begun digitizing records of all NGOs to track their activities, locations, and project timeline, thereby enhancing transparency and accountability.
I really appreciate your support, time spent here, because without such planning, if they leave abruptly, like it happened in Fulka, Goza some time ago, things were then very tough for the state government. So therefore, it is imperative and incumbent upon us to draw up such documents, and I can now give all the partners coming in for me to sign the MOU, so that we have to have your exit plan. This is how it's going to take place. We've also started digitizing all the partners. So, in our computers, if I said, let me have file on, IMC, for example, and then they will just bring up all the details, when they came in, when they plan to go, what they are doing, which parts of the state they are, etc., etc. So this is how we've been working now systematically in the Ministry of Health to ensure that, partners actually deliver what they promise to deliver. And I have intentions of calling up all the partners for a NGO or partner day. In that way, then they can present what they are doing, and I can give them hand to hand this transition plan. By so doing, we should all be on the same page. I have sometimes told them, if you cannot key into Borno State strategic plans, please don't bother, you can go. In that way, they realized we're serious. And then before I actually sign any MOU, we have a legal desk officer, a qualified barrister at law, who will go through the documents, because the devil is in the details. And therefore, I cannot say I can just go through within 10 minutes and pick up the details. So now the legal desk officer, who is part of the DPP, so she will actually not send it back to me, but said, this MO is okay, sign, date. Then I sign. so that all we're doing is to protect our people. We're expecting a NGO to come in sometime. They've been here once and they have agreed to spend money in the state on maternal health care. But I told them, you have to come and we co-create. So you want to spend money on maternal and newborn care. So we'll tell you, this is what we want. And these are the parts of the state that you should focus on. And then, we then agree together before we allow you to have access to our system. So things are changing. It's not business as usual. We are holding them, accountable for the funds coming to us or meant for us.
Moving forward, do you think the development and progress of the healthcare sector in Borno State is by chance? On the contrary, it's because the executive governor of Borno State, Professor Babagana Umar Zulum, and the Commissioner of Health are united in their goal and genuinely have the people of Borno at heart. This assertion was made by the Registrar and Secretary General of the Nursing and Midwifery Council of Nigeria, Dr. Alassane Dagi, while commending the substantial investments made by the state government in the healthcare sector. An accreditation team from the Nursing and Midwifery Council of Nigeria, led by the Registrar Dr. Ndagi Alassane, visited Borno State and assessed the two colleges. The Commissioner for Health and Human Services, Professor Baba Malamgana, escorted the team on a tour of various health infrastructure projects initiated by Governor Babagana Umar Zulum. This tour highlighted the state government's comprehensive reforms to the healthcare system. The delegation began its visit at the Kashim Ibrahim University Teaching Hospital and Medical College, where the Chief Medical Director, Professor Ibrahim Kida, provided a detailed briefing on institution's various departments. The team was guided through the facility, where they observed the seamless operation of the electronic health record EHR system. This fully paperless system integrates all departments from medical records to triage to doctor's consultations and the pharmacy. The EHR streamlined workflows and enhancing efficiency. At the conclusion of the visit, Dr. Alassane made the following remarks.
I think I should commend the state government and generally the Honorable Commissioner and His Excellency share a common goal, and that is the driving force that all the transformative activities that are taking place in the state are being engineered by the mindset they have. They have a common mindset in providing the best for the people of Borno State. It is heartwarming that in a primary healthcare facility, they try to digitalize their activities. They have electronic record of activities, and then most importantly, there is a part that is being shared of us that in Nigeria it was shouted severally in the time past, but we are beginning to see the actualization of it in Borno State. And what is it all about? It is about task sharing and task shifting. For a midwife now to be the one in charge of the scanning, and she is doing it perfectly, it is because the doctors agree to share their own responsibility with her, and they aims at saving life, because the key thing behind it is not releasing their knowledge to her. It is aimed at saving life. By the time a patient comes into the hospital, the doctor may be around or may not be around. This woman can handle this patient and do the needful, except when it becomes necessary that it has to be a surgery case. The woman is so perfect about what she's doing. Then we went on to another center where we have this safe birth bundle care. It enables the midwife to monitor both the mother and the baby. And then the life-threatening situations are being monitored instantly and are being taken care of. For now, in practical terms, the Nurse and Midwifery Council got the support of Gate Foundation, but it was to a few selected schools in various states. Here in Borno, it is covering the whole state, meaning that Borno state has taken a giant stride to absorb this and then implement it at their own level, such that the people who come to these healthcare centers, you see, generally why people go to stay long in the general hospitals or in the tertiary health facilities is because of the non-functional of the primary healthcare centers. It is not every disease or every condition that should go to these facilities. With what I'm seeing in Borno, there will be less congestion in the hospitals. The electronic record, you had me sharing with the Honorable Commissioner that it saves time, it decongest environment, there's free ventilation, and all sort of record keeping that has to be manually done before, that is likely to be loosened at any time, are now.
The Karasan father stated that based on what they have seen so far in Goza and Monguno, approval for the commencement of the academic activities in the two colleges is assured.
Here in Borno State, for the accreditation of newly established colleges of nursing at Goza and Mangunu. And since we arrived, we have been inspecting various facilities, out of which in proposal to also establish a nursing program in the state university, we have come to see the available resources in preparation for the takeoff of nursing program. Certainly, there is no way you say everything is 100%, but nevertheless, what is on ground is very adequate to enable the takeoff of the colleges. All that, a few observations that were made are to strengthen and then facilitate learning. That is just the shortfalls that we notice. But what is on ground are adequate for immediate takeoff. Everything that we want to say today is to advise on how to strengthen the system. Everything has been established, but nevertheless, you see it this way, you see it that way, and all the areas of such weaknesses that we identify, we have shared it with the relevant authorities for them to strengthen.
In a post-visit interview, the Commissioner for Health, Professor Baba Malamgana, and the Chief Medical Director of Kashim Ibrahim University Teaching Hospital, Professor Ibrahim Kida, appreciated the accreditation team for their dedication. They also applauded Governor Zulum's giant strides in transforming the state's healthcare sector, noting that his provision of the right infrastructure and equipment made it easier to gain approval for their programs. Thank you for joining us. Stay tuned for the next week's update, where we'll explore more innovations in the healthcare sector. This is Ibrahim Amarawa reminding you health is wealth and Borno is on the rise.